ได้ยินไหมคะทางบ้านได้ยินไหมคะทางบ้านได้ยินไหมคะถ้าใช้แบบนี้ได้ยินไหมคะ
ชัดกว่าอาจารย์
อันนี้นะคือถ้าไม่มีอันนี้เดี๋ยวที่บ้านไม่ได้ยินปะ
ที่บ้านก็ได้ยินแต่เวลาเขาพูดออกมาเราจะไม่ได้ยิน
อ๋อค่ะ
ใช่นี่มันจะ
ชัด
ชัด
ค่ะโอเคค่ะได้ค่ะภาษากยาคุณดิพระเจ้าcan you hear me well Okay, all right. I would like to give my sincere apology that we are late today because we underestimate the time to travel from Bangkok to here. So, and we lost a little bit during the time. So, I would like to apologize for the delay. Um, we are very honored to be here today. And I understand that with this course, you already have learned something from the first course, right? I would like to know that if there is any of you who have the medical background, anyone? Pharmacist, okay. So let me introduce myself. My name is Dr. Suthida Suwanvecho. I'm a medical oncologist, hematologist, and palliative care specialist. And also a former student of MCU and get the PhD from Peace Study here. Um, we are the student of Thai Thich Nhat Hanh from Plum Village. So I and my sister very interested in the practice, and we also use the practice in our daily life and our work. And I'm very glad that all of you is interested in this subject, and hopefully that there is more and more people out there and use the mindfulness and to help other people and help ourselves. So, and this is my sister, Dr. Buntharika. We are blood sister, and she is the dentist and also, like me, the PhD in peace study. She graduated before me. So, and we are both of us the student of Thai Thich Nhat Hanh, and very honored to be here uh, and share. I think that is echo or okay. Um, and share our knowledge. I think that we are not I don't want to call ourselves the expert. So we are a practitioner and we are in the medical field. So we be able to match the medical field uh, with our practice. So I would like to share what I know and I don't understand, and I am open to for the question and the sharing from you guys as the practitioner as well. So before we start, let's listen to the sound of the bell. Come back to ourselves. So in Plum Village tradition, when we listen, we hear the sound of the bell, we have a commitment to come back to ourselves and follow your breath at least 3 times. So in that way, we can come back to ourselves and practice mindfulness by listening to the sound of the bell. And in Plum Village Practice Center, we use the sound of the clock chiming every 15 minutes as the sound of the bell as well. So every 15 minutes, we have a chance to come back to ourselves and breathe. So in that way, during the day, it has a reminder because in our world, we usually go, our mind is just come and goes. So if we have something to remind us to be mindful, I think that is the good practice. It doesn't have to be the sound of the bell. I myself, when I practiced in the hospital, every time I wait for the elevator, I breathe. So I follow my breath standing there. So that is my sound of the bell. So that is the way how mindfulness practice, especially in the West, has been taught as well. You find something that remind you to come back to yourself. But today is the subject of the brain and Buddhism. And actually, I think we should maybe change it to nervous system and Buddhism. And for the people who doesn't have the background on the medical field, it is very daunting task to explain everything in just 1 day or a few hours because this is like the whole um, learning with the specialists in the neurologists. They have to learn so many years and they're still learning. So I don't think that we're gonna have to explain everything in detail, but just have the idea and what how nervous system work. And when you in the future, if you have a chance to read the paper from the Western, and so you know what they are roughly what they are talking about. And if anyone want to further study in this field, you have some basic, uh, and also you can be confident that the mindfulness practice is not contradict with anything that neurology studying is learning now because the Buddhist is very old, 2,500 years old. The scientist is just follow along. The scientist doesn't know everything right now. So maybe the Buddhists know more and they have to prove later because the one time that there is a, a retreat in Plum Village in France, and I have a chance to attend with Thai. Thai said that anything that we don't know, the scientists, the good scientists, anything that we don't know, we say that we don't know, but we don't say that it doesn't exist because it may be exist, but we don't have a way yet to prove it. So anything that we still cannot prove, it doesn't mean that it doesn't be, has not been there, but you have to say that, oh, I still cannot prove it. So because there is a tendency also in the scientific world that they're gonna disregard anything traditional that is not exist or is not real. So just open. He teach the scientists how to open the mind because if the scientists don't open the mind, we will not know that the world is round until today. We maybe think that the world is flat, So, and also like in this room, there is also the TV signal, but we don't see it because we don't have a television now. So the 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 TV signal is there, but we don't see, we don't hear because we don't have a good receptor for it. So that's how the relationship of the Buddhism and the science right now. Okay, but so far there's science that showing us it doesn't have a contradiction with the Buddhism. So this today we will talk about first of all the basic of the nervous system. I don't know if you already have the basic uh, with the previous talk or not, but I just gonna, if it has been taught before, we just gonna review it, okay? And then we will talk about emotion and other things by Dr. Buntharika. And on the after lunch, we will do some of total relaxation, and we will talk about mindfulness in medical field, what the clinical trial that have teach us until now. Okay. So for the nervous system, we have to know that we talk about central nervous system, which is brain and spinal cord, and peripheral nervous system that outside the central nervous system, the system that allow us to have the touch feeling, walking, and also the autonomic nervous system. Okay. So for the brain, uh, this picture showing that there is a different part of the brain. We talk about anatomy first. The biggest one is called cerebrum. Okay, this is the biggest part of the brain, and the cerebellum is the smaller part in the back, and the brainstem that connect the brain to the spinal cord. Okay. So for okay. So for this brain, sorry, the cerebrum, we divided into like a frontal lobe in the red, the parietal lobe in the blue, occipital lobe in the purple, and temporal lobe in the yellow. Okay, so this is like when you read the paper or the book, that is how the brain anatomically, when they talk about frontal lobe, you know what it is. When they talk about parietal lobe, you know what it is, occipital and temporal lobe. Okay. Yeah. Oh, okay. Okay. So that is like the outer part of the brain, okay, the cerebrum. But inside the brain, we call there is also structure inside the brain, okay, and like cingulate gyrus, the corpus callosum, and we will talk about it later. Pineal gland and so on. So the brain is just like outer layer, and then there is a middle layer inside as well. Okay. So it's just like if you separate the outer layer, you will see the the central part of the brain, the middle part of the brain in in inside that outer layer as well. So what is the important? I think this part is important to our emotion, and also that part will be important when we do the mindfulness practice, what we want to do with it. And there's including the amygdala, the hippocampus is just like the horn here, the this all the part that it is in the middle. We call it the limbic system. That is a complex set of the structure in the middle of the brain, including hypothalamus, hippocampus, amygdala, and all. So, so moving from the brain, you see that we have the brain stem that connected from the brain, and then it will connect it to what we call the spinal cord that it is run through our body in the back. This spinal cord is protected by the vertebra, which is bone on the, so it is very protected. You see that it is protected by all the bone, and it will run until the lower back. Okay. And this the part from the brain and spinal cord, we call it central nervous system. So if we cross cut the spinal cord, okay, you can see that even it in the small part of the spinal cord, very small in our body, it is a complex system because it has the ascending tract that have to get our sensory stimuli go back to our brain, interpret, and then the descending tract that the command from the brain coming back and tell the organ and go to the peripheral nervous system, tell the organ how to move, control the motor, control. We have the sensory going up, the motor command from the brain going down as well. Okay, so even in the small spinal cord, it is you can see that there is a complex system, and if someone cut the connection, then the brain cannot command the organ below that. Like so you become paralyzed, and also you cannot get the sensory up as well. So how is the brain and the nervous system connect or working? So we have to know about what the scientists know about it. We know about the neuron, okay? And one neuron have many receive many input signal through the dendrite. We call it dendritic. And the output signal will go through what we call the axon. So we have a dendrite and axon. So one neuron can get the input from many neurons, and then the sum of the input, they will get the output, the sum of the input interpreted and output through the axon connecting to the other neuron by the dendrite of the other neuron. Okay, but it is not like the solid connection. That is a gap between the end of the axon and the dendrite. We call the presynaptic gap. Okay. So how is the communication happens? It is the called the action potential. So it is uh, electrochemical. So that is a function of the membrane, the difference between the ion plus minus ion between the membrane, causing the influx or outflux and causing the what we call the electric wave action potential that go through the axon. And by the end of the axon, that is we call the synaptic vesicle. What it has is that when the action potential come to the end, it causes the synaptic vesicle to merge with the membrane and releasing what we call the neurotransmitter into this presynaptic to the synaptic cleft. And this neurotransmitter will attach to the receptor at the dendrite. And depending on what kind of neurotransmitter, it will tell the other neuron to stop or to go, or to make another action potential, or to inhibit or to stimulate the other neuron. So it's kind of the signal is just like that. It's just like a computer that we have this I like 012 code, right? So this is just like that as well. So you can see that one neuron has many synapses. Okay, so they have an input. Some input say it to inhibit. Some input say it to fire. So the sum of the input will determine if that neuron will fire to tell the other neuron to stop there, or to tell the other neuron to continue firing, or tell the other neuron to stop. So you can see that it is a very complicated system. And neurotransmitter have many kind of neurotransmitter. And one neurotransmitter in one area may be inhibitory, in one area with one receptor may be inhibitory. But when it attached to another receptor, another type of receptor, maybe it is telling it to fire. Okay, so even one neurotransmitter, it doesn't make it to be inhibitory or stimulate. It depends on the receptor at the end, at the dendritic of other neuron as well. So that's why until now, the neurology still have the investigation, try to understand any part of the brain. Okay, so this is the scientific world that still ongoing in the research part, try to understand the nervous system. Okay, so I'll stop for a while because I think this is a lot of information already. If there is any question, please ask because we're gonna go to other part. Anyone in the Zoom? Okay, chat. Okay. We will do the deep breathing for deep breath to gain the oxygen to our brain and help it work properly, because we have more information to insert to your brain. Yeah. Sorry. So we will stop to breathe for 3 breaths, and we take some we breathe deeply so we can gain our oxygen to our brain to help it a little bit, and we can receive more information after this. Okay. You want to hear the sound of the bell? Maybe I invite one sound of the bell and we follow our breathing for 3 breaths. Okay, next we will see. Yeah. I think that is the difficult question, because, like I said, that all of this, like a GABA, it has a more inhibitory, we know, but like I said, in the different part of the brain, it has different function. So you may have the knowledge, for example, serotonin, that if you lack of serotonin, the patient may have the depression, feeling more depressed or something like that. But it's not all that rely on the serotonin alone. And in serotonin in some part of the brain may have a different function. So it's just not as simple as just you increase serotonin and the patient will become not depressed. I think that is too simple. And I think the medication right now, of course, they have used all these factors that they research for, but I think the function of the brain is more complex. But by just adding the one substance is not gonna solve the problem. Like, for example, we know that when we do meditate, our release the uh, opioid-like substance. Okay, so uh, so we feel a little bit relaxed, calm, and euphoric. But when people use the opioid, uh, the morphine or the heroin, it have a reverse effect, become addicted and all these things. So the substance is not I think that we can learn that which one is more produced, but it's not like that. If you know about it and you think that, oh, this is a good, and you give it a lot, then it will maybe not the answer. Okay. So as I'm not the neurologist, I didn't really do the research on this thing, but these things will come up more and more. But when you read about it, you have to be mindful and not have a critical thinking and have a reserve as well, even for the scientists finding. Okay. So I'll show you this how the Buddhists and scientists rarely agree, and you can see this is seeing, right? You have to have the light onto the object and reflecting into the eyes, which is the the first part that receive it, and then this will be changing to the neural signal, the nerve signal through the optic nerve into which is the peripheral part of we can call the peripheral nervous system to the brain. Okay, and the brain we have the area that receive that signal and perceive it into and get more signal to the frontal area part of the brain to have, and also in the middle part of the brain, that what you see causing you the emotion or what is interpreting what it is. So if you talk about Buddhism, this is the outer ayatana, the sensory, the inner. Okay. And then you have to perceive, then interpret, and then feel. So that five skandhas is there and is have also uh, can be explained in the scientific way. Okay, so this is another angle of the seeing pathway. So we know that if you lack of these the eyes, then you cannot get the light in, then you're blind and you cannot interpret what uh, you cannot see. Okay, so any part of the pathway is interrupt, then you cannot interpret or see. Okay. So, like I said, that when the nervous signal from the eyes, from the optic nerve, come to what we call the visual cortex. This is the first part that perceive it, but it also have to send the signal to the frontal cortex to interpret what it is. Okay, that's the front of the brain, and what to do with it. Do you like it or not like it? Emotion happens, and then you determine what to do with it again. And that is the same as the other six sensory organ. Okay, the pathway to the different part of the brain, but follow the same pattern. So this is like the how the brain and the pathway function, but we also have what we call the sympathetic nervous system. Okay, and this is like um, control the heart, the breathing, the uh, the gut, okay, how it is active or non-active or releasing the um, enzyme or not. Okay, so it called the autonomic nervous system, which have the two components, the sympathetic nervous system and parasympathetic nervous system, and it use different neurotransmitter that I'm talking about. Okay, and that come to what we know about fight or flight or freeze response. When the sympathetic nervous system was stimulated, it have an effect on many organs. For example, the pupil will be dilated, the mouth will be dry, fast breathing, the heart pounding, tense muscle, slower digestion, and sweating of the palm. And this is for our own survival. When you have a treat, like if you've been an animal in the jungle and you have to run away or fight the treat that threat your life, that the sympathetic nervous system will be activated. Okay. And most of the time, the amygdala is the one that react to the treat, which is because it react very spontaneously and very fast, because you need a fast reaction to survive in the jungle. So, but that is also become a problem because we are not in the jungle anymore. And if we perceive something as stress, this sympathetic nervous system will be activated all the time. Like if you go to the traffic jam and you feel stressed, it will activate. And if for minor thing in life and it become activate all the time, you can see anything that activate all the time, it will be bad. And because it also has the, after it have a first response, it will also activate endocrine system, including adrenal cortex. Okay. And release steroid and make your body or to be tense in this stimulate situation all the time. And as an oncologist, I can say that if you in that stress situation and have this stimulate all the time, then your cell will be exhausted and it can change to cancer cell. So cancer is one of the stress-related disease. If you can be less stressed, then your risk of cancer may be lower. So this is a summary in the fight or flight or freeze. In short, is the brain react to the treat, the sympathetic nervous system activate. This response dilate pupil, tense muscle, pounding heart, fasting, breathing, prepare to run or fight. And this the part is the happen very rapid and unconscious, and adrenaline surge. If the treat go on, the hypothalamic pituitary adrenal axis activate. This is endocrine exit. So it keep you, the cortisol will be continue to be released. If it's not the, when the treat is in, the parasympathetic system reactivate and you come back to relax mode. Okay, so you don't want to have your cortisol activated all the time for sure, because it can cause other disease, chronic disease in the long term, like cancer, like I said. So this is just a brief summary, the difference between sympathetic and parasympathetic nervous system. So basically, relaxation meditation is the to put our body in the parasympathetic system mode. So it's no longer activate the sympathetic system. So we know that. And the the scientists have many way try to research or to understand the function of the nervous system and the brain. One of the tool is to do the MRI. You can see anatomical of the brain, and also functional MRI when you see how which part of the brain has more blood supply at certain point, and they assume that the part that have more blood supply is the part that is activated at that time. But so it's just a rough estimation, and also EMG when they catch the electromagnetic wave in the brain, but you have to also see that it is the sum of the wave, not one wave of the one neuron. So we don't have that to catch that one neuron do what, but you see the sum of the wave only. So it's still not the most accurate tools, but the tools that the scientist is doing now. Okay. So now what I'm gonna go with this a little bit. What we know, so this is like a functional MRI. Okay, so you see that where is the blood go, and you can uh, um, estimate that, or you can say that okay, maybe that area is more function at that time. Now, what is mindfulness? That is a story of Mr. Phineas Gage in 1848. And he is a railroad worker, and he survived this rot that damaged his frontal brain. Before his accident, he was very polite, responsible, hardworking, and socially well adjusted. But after the accident, he became impulsive, irritable, irresponsible, socially inappropriate. What they conclude with this is that frontal brain, especially the most frontal part, is the part that control our well-being behavior. And when it was destroyed, the middle part, the amygdala and limbic system is working, and it is more like a animal uh, response. So there is no such thing that control that part anymore. So if I would say that where is mindfulness in the scientific world, I would say that it's probably located somewhere around this prefrontal cortex area. So I'm gonna stop at this point, and then Dr. Buntharika will come over and talk a little bit more about emotion, fear, and all these things. So before that, I will have a break for. But the monk have to go for the lunch. What time? 11, right?
Yes,
Break
Ajahn.
after lunch. Yeah, 40 minutes. There is a 20-minute more. Do you want to talk anything? Okay, I think that we will break here, and we may listen to the sound of the bell and meditate for 5 or 6 minutes, and then we get break, and then we can have lunch, and then come back. That's maybe better.
Hello, honor student. We will take a break here. So see you again at 1 o'clock.